All right, this year it is more important than ever to get our flu shots. I got mine. Sarah, you have yours?
I have mine.
All right, tomorrow, Total Health will be holding outdoor flu shot clinics in our area. They're going to be in and around the Druid Hill area. That's the one that starts at 10 o'clock and ends at 2. And the Weinberg Y in Waverly that starts at 1 and ends at noon. No registration is required. Flu shots are free. Patients should bring their insurance cards, and if you're not insured, you can still get a free flu shot. Masks are required, though, for people over 2 years old. Shots are available for patients 9 and up.
It's because the symptoms related to COVID and flu are very similar. We want people to ensure that they have been vaccinated for the flu so that they're able to distinguish between COVID symptoms and flu symptoms.
All right, Nick, make it a 2-for-1. Anybody who shows up, you can also get tested for COVID as well. There will also be food distribution event happening at the clinics. That starts at 10, and you can find more information about those clinics on our website at WMAR2news.com.
Experts are concerned that people who are unemployed are suffering more mentally. We talked to a professor of economics who has studied the psychology of unemployment. He tells us some people become more emotionally distressed by losing their job. Those who don't have a financial buffer, have young kids, or are minorities can feel like they're less likely to be rehired. Unemployed people are normally optimistic at first, but after 5 or 6 weeks, feelings of hopelessness or anxiety increase.
That's when I would say that psychological distress really arises, and poor emotional well-being starts to become a footprint of that bout of unemployment.
That's concerning because, as the director of the New Start Career Network points out, the number of those unemployed long-term has ballooned during the pandemic. Combining the stress of the health emergency with the stress of being unemployed just compounds an already difficult process.
You know, your self-esteem can take a beating if you apply for jobs and get a series of rejections and you don't know why, or maybe you don't hear anything, so even pre-pandemic, we know how stressful it is.
The center suggests breaking up your job search and related goals into small, manageable steps, like redoing your resume or building your online presence in chunks. Find activities that reduce stress, and while looking for full-time employment, consider part-time or gig work. That's because it's easier to find a job when you already have one. The center is also partnering with the Mental Health Association of New Jersey to offer online health and wellness workshops. More in our lineup. Thanksgiving is a big challenge for colleges trying to prevent COVID from spreading. The options that universities are using to keep students and their families safe before and after the break. We're all thinking of healthcare workers as this new surge of coronavirus spreads across the country. Dan Grossman talked with 2 of them who treat COVID patients daily, and they say they're using what they learned in March, April, and May to better treat people.
If there is anyone to help navigate the uncertainty hospitals have faced since spring,
it has been very busy, and it has really, as you mentioned, gone up in the last 2 weeks.
Dr. Julia Limes is it.
My second year of residency was the Aurora Theater shooting, and I was the ICU resident that night.
That night, she helped manage the response to a disaster that forced police officers to use their patrol cars as ambulances when a gunman killed 12 people at a movie theater in Colorado and injured 70 more. An unprecedented situation that has brought clarity to the one she finds herself in now.
We have started deploying people from other parts of the hospital to come and help us on both the COVID floors and the COVID ICU.
Across the country, hospitalizations from COVID-19 are rising fast.
We've already surpassed the numbers from the first surge, so we're kind of like, okay, what's next?
For critical care nurses like Maddie Smith, the fear, stress, unpredictability might have consumed her once more if it wasn't for the lessons learned in this very COVID unit you see before you.
We just know how to treat them better, and we know when to intervene, like sooner versus later, with different interventions. So that's been really helpful.
Because of the dangerous nature of what is in here, the hospital shot this video for us. It shows the practice of undeniable strides that have been made in hospitals since March. Medications to treat COVID symptoms are available. Vaccines are being developed with remarkable effectiveness. And the arc of how a patient might respond to symptoms is now better known.
It's easier and it's smoother than it was in the spring.
Dr. Lime says it allows them to manage bed space better and adds a critical element to care, composure. that can be seen in how patients are treated and how these first responders treat themselves.
It was hard. I mean, I think the biggest part that got to all of us was that these people, they don't have family to be with. That first surge, it all hit us pretty hard because of the sadness that, what happened down here. So yeah, we just kind of leaned on each other and got through it, but it was tough.
How far this current wave will go is unknown, but by drawing from the past, these first responders know they'll be ready to deal with it, no matter what is thrown their way.
We just have a better sense of the trajectory, and that is hugely valuable, I think, as we go into this next surge.
I'm Dan Grossman reporting.
And now from WMAR 2 News, Maryland's most accurate forecast.
Happy Thursday, everyone. Not only did we deal with more seasonal temperatures and some sunshine earlier today, but we also dealt with a very beautiful sunset. Hopefully you had a chance to get outside about an hour ago and view the beautiful sunset and get a glimpse of it. This was sent to us by Maria in Sparks, Maryland. I like to call this a cotton candy sunrise. You can see the clouds look kind of wispy. We like to call those cirrus clouds because they're very high and thin at high altitudes in the atmosphere. But as we take a look at radar right now, scanning the skies, not picking up on a whole lot of precipitation, but satellite is still showing some of that high thin cloud cover drifting in from west to east, mainly situated across the Mason-Dixon line. But that'll start to erode up to our north as high pressure continues to move offshore. That's going to keep us dry tonight, and winds will stay out of the south as we head into your Friday. Likely will stay the case as we head into your Friday afternoon. Mainly dry conditions persist throughout your Friday, but with that southerly wind flow, that will really help our temperatures stay a little bit milder than they were last night, which is good news. Temperatures tonight across Baltimore County, even across the metro, will only drop down to the mid and upper 30s, even the lower 40s out towards Dundalk. Essex could be dropping down to 42, 37 up towards Parkton. As we head into tomorrow afternoon, though, we do look to make it back up above normal. So we hit a high of 53 today. We look to hit a high about 10 degrees warmer tomorrow, in the lower 60s, upper 50s, closer to the bay over by Essex. But tomorrow is not going to feel too bad, and we have more sunshine and plenty of dry time to go around. So definitely take advantage of that. Get outside with the dog, go for a walk or a run. Definitely do something outdoors. Tomorrow morning, though, yes, it's going to start off a little bit chilly, but certainly milder than we were yesterday morning. Or this morning for that matter. But as we head into tomorrow afternoon, temperatures look to creep up into the mid to upper 50s by lunchtime, lower 60s as we head around 1 to 2 o'clock with wide open sunshine. And we actually look to keep temperatures above normal for this time of year. So our normal high is 55 degrees. We're looking to be above that heading into your day tomorrow, low to mid 60s heading into your Saturday, a little bit cooler as we round out the weekend and head into early next week. And we are looking at that slight chance for rain showers as we head into Monday and even for Thanksgiving Day.
As the Thanksgiving holiday approaches, college campuses across the country will empty out. Tens of thousands of students will head home for the break, and public health experts fear mass travel and indoor gatherings could spark super spreading of the coronavirus. Usher Qureshi takes a look at how some universities are preparing.
Within days of returning to campus this fall, Brianna DeWall contracted the coronavirus.
We went out to a party and all my friends got it. So we're assuming someone at that party had it and didn't know.
The return to college campuses in August and September coincided with a 55% increase nationally of COVID cases in young adults ages 18 to 22. Next week, DeWall's headed home for the holidays, but plans to get tested before she travels.
I will be flying, so I feel like that's a precaution I should take.
While her school isn't requiring mandatory exit testing, other schools are. Penn State is offering free voluntary exit tests. The University of Michigan has made exit testing mandatory, and New York State's university system is also mandating a negative test result for all of its students before they leave campus.
Some people may get a test. That's not going to decrease the risk to zero, but it is going to decrease the risk substantially.
Dr. Amish Adalja is a senior scholar with the Johns Hopkins Center for Health Security. He warns that without extra precautions like frequent testing, mask wearing, social distancing, and self-quarantining ahead of the holiday, the risk of community spread is high.
It is going to be a major challenge when you have your student body move from campus back home and then come back on campus, because that's likely to introduce more levels of infection.
Earlier this year, researchers tracking 7.5 million students at more than 1,300 universities concluded that thousands of college students may have picked up COVID-19 while at densely packed spring break destinations, only to return to infect others with the virus. Some schools like DeWalls are not having students return to campus until January and have canceled spring break. But once again, testing is voluntary.
I think we should have to get tested before we come back, and I think it's very careless that they aren't requiring us to get tested before we go home.
The CDC hasn't issued any specific COVID guidance on colleges and break, and while the American College Health Association encourages testing, it stops short of calling for it to be mandatory.
And colleges, we know, have been hotspots for infection, especially with off-campus activity. So I do think this is going to be particularly challenging to accomplish.
I'm Usher Qureshi reporting.
The CDC recently updated its diabetes surveillance system. That's a database that helps public health experts and doctors find certain information about diabetes in their communities. The CDC has now added 15 social vulnerability variables to the database. That includes information about poverty, education, and access to care, and healthy food, among other factors.
So if we can really see exactly where those communities are, we can have programs at the city level, even the community level or the state level, that try to make it more possible to have more parks, more walkable sidewalks, and that can be a major factor in effectively managing and treating diabetes.
Differences in healthcare access, along with racial, ethnic, and socioeconomic status, may increase the risk of type 2 diabetes. Finally, in our lineup, there's a unique but largely unrecognized group of people taking care of adults with all sorts of health challenges. We're recognizing Black men who are caregivers, the obstacles they face, and a touching fact about them that deserves attention. Racial disparities and bias in healthcare can be a double whammy for multi-generational families of color, specifically when Black men are the caregivers.
We tend to think of the male caregiver as that individual that comes helicoptering in and, pays the bills or may take care of yard work, but that's not all that male family caregivers do.
AARP is putting the spotlight on this sort of unrecognized group of caregivers. Through research, the group found there are nearly 3 million African American men taking care of an adult family member or non-relative, usually someone with memory, emotional, or mental health conditions. Conversations with these caregivers reveal unique challenges and stereotypes they face, like healthcare bias.
If he is going into a situation with an understanding that there may be a bias. When we talk about higher levels of stress, that would be one thing that could cause more stress for an African-American male caregiver.
And adding to that stress, it's also revealed that Black men are less likely to ask for help. They are often still working essential jobs, facing financial impacts due to tough choices about balancing their career with their caregiving responsibility, even more so now with COVID and the risk of bringing it to a loved one. But they are some of the most dedicated people. A majority of African American caregivers find a sense of purpose or meaning in that role more so than other caregivers. AARP asks providers and community-based organizations to look at these people as individuals.
Increasingly, male family caregivers are bathing their mothers. That's a difficult thing. And so as a provider, are you talking to that male caregiver about what that may mean to them emotionally?
All right, take a picture of your screen. AARP has a caregiving support line. Its Caregiving in the U.S. report also highlights other ethnic and unique caregivers, everyone from students to those living in rural areas. As we inch closer to having a COVID vaccine, people are asking the question, can someone be required to get it?
The problem with mandates is that many times people do not like other individuals telling them what they need or they don't need to do.
Tomorrow, whether a vaccine requirement could really be enforced.
More people are relying on their neighbors as they navigate this pandemic lifestyle. Now a national nonprofit is helping make connections for those in need. On WMAR2 News at 6, how they're using those connections to make some positive changes in a lot of people's lives. Stay with us.
You're watching the station that's working for you. Now, WMAR2 News at 6.
Well, good evening and thanks for joining us for WMAR2 News at 6. I'm Kelly Swoop.
And I'm Jamie Costello. With the highest single-day numbers of COVID cases yet and new restrictions ready to take effect, the holidays are expected to take a hit. but not for one town in Carroll County.
WMER2 News' Jeff Hager has more on that story for us tonight.
In spite of the surging COVID-19 numbers, the town of Hampstead is moving forward with its holiday celebrations, including a tree lighting here at the War Memorial on Friday. Flashy red bows and garland trim adorn the town. And while COVID-19 threatens to deep six annual celebrations everywhere, Hampstead is determined to stay open for the holiday.
We did hear a lot of talk about it. You know, we just have the Main Street revitalization all done, new streets, new sidewalks, new lampposts. And we really just felt we still had to find a way to bring this community together.
We've tried to do a couple of things.
Mayor Christopher Nevin says in 8 months, the town of 6,300 people has experienced less than 150 cases of COVID and a single death.
That's all that she's going.
Still, the town isn't throwing caution to the wind when the celebration kicks off on Friday.
We did make some changes. Obviously, school's not being in session. So we have, normally it's a 5th grade elementary school band that's been doing it every single year. And the high school band that came, and some Boy Scouts and Cub Scouts. So it's very community organized. And they sing for about 40 minutes before Santa Claus comes. So obviously that's not going to happen.
Instead, a church group has stepped forward to provide a choir. And then a fire truck will deliver Santa to a spot in front of the War Memorial on Main Street, where he can wave to people as they drive by in their car. You may be the mayor that saved Christmas. I don't know if they called you that yet.
No, I doubt it, but thank you. I think, it still gives everybody a little taste of the holidays, and that's what we wanted to do in the current circumstances.
Humbug to the holidays? Not in this town. And many here say that's something to celebrate.
I think for all ages, and I think that's what's great about this town of Hampstead is because whether you're 99 or 9 months old, it brings everybody unites in this town.
The town is also starting a new tradition, Candy Cane Lane on Main Street. It's a decorating contest pitting business against business, home against home, all to find the best decorated establishment the last week of December. Reporting in Hampstead, Jeff Hager, WMAR2 News.
Well, following a possible uptick in cases following Thanksgiving, Baltimore City Schools and the Archdiocese of Baltimore are now temporarily going all virtual. This will happen starting Monday, November the 30th. Baltimore City Schools announced all in-person learning programs and meal sites will be canceled through Friday, December the 4th. The Archdiocese says schools will go virtual for 3 days after the Thanksgiving weekend.
And let's talk about those numbers. A record number of COVID-19 cases here in our state. 2,910 new cases in just the past 24 hours. So right now we're looking at 733 confirmed cases here in our state. 1,192 people with the virus are in hospitals in Maryland, 48 of them in just the past 24 hours. And the positivity rate really skyrocketing, up 7.19%. And we've lost 19 more people to the coronavirus here in Maryland. Today, Governor Larry Hogan and other governors met with President-elect Joe Biden and leaders of his COVID-19 advisory board. They discussed efforts to slow the spread of the virus. The meeting took place virtually. During the video conference, Hogan also pushed for leaders in Washington to reach an agreement on another stimulus bill for the folks in need.
Well, you won't be able to watch Maryland football this weekend. It's been called off. The Terps had announced that their game Saturday against Michigan State has been canceled and it will not be made up. 15 players have COVID-19 as well as 7 staff members, including head coach Mike Loxley. Everybody is currently in isolation.
You know, with the rising case numbers, the CDC has issued new guidelines for Thanksgiving. That's 1 week from today. WMER2 News' Abby Isaac spoke with experts at Johns Hopkins. They shared what measures that we can take as well as what our leaders should do to try and stop the spread.
Experts equate it to pulling the emergency brake, enacting targeted restrictions to control the spread until we have a vaccine that's widely available. New COVID-19 cases and hospitalizations are surging nationwide. Johns Hopkins experts say it's now the #1 cause of death in the U.S. And unfortunately, they believe it's only going to get worse, saying there's usually a 3-week lag between when we see cases and when we see deaths. But today, during a virtual press conference, experts say it's not too late to reverse these troubling trends. They say we need to continue wearing masks, maintaining physical distance, and avoiding large gatherings. And in places with widespread community transmission and where hospitals are starting to come under strain, they recommend leaders close high-risk activities like indoor dining, bars, and gyms, but through a targeted approach while scaling up contact tracing.
In the course of contact tracing, those tracers learn a lot about where people have been in the last few days that may have contributed to their infection. And so that's a really important source of data for helping to target these restrictions as narrowly as possible so that they don't have to be community-wide closures.
The key is to try and limit the damage that's done over the next 2 to 3 months or more until we have a vaccine.
Experts expect most people won't be vaccinated until the spring or summer. So, in the meantime, these continued efforts by everyone in the community are critical, especially with the holidays approaching. Today, the CDC issued new guidelines for Thanksgiving, urging Americans not to travel and cancel any plans with relatives that are outside of your household. In Baltimore, Abby Isaacs, WMAR2 News.
Abby, thank you. And you know, more than 1 million people of you have now signed up for that MD COVID alert, and the State Department of Health launched the exposure notification system last week. It lets you know if you've been near someone who tested positive for the virus. This is available for both Apple and Android phones. And for details on how to subscribe, you can head to our website right now at WMAR2news.com. All right, now time for a check on our weather here today.
All right, it was nice and sunny today, but a little bit chilly, and this is going to be our new pattern, right, meteorologist Patrick Pete?
It's going to be chilly in the mornings. I think we're going to have some slightly better numbers as we head into the afternoon, especially for the next 2 days, but those chilly temperatures will definitely return. We're kind of in that transitional period where there are chilly days and then there are days that aren't too bad. Right now, we're experiencing a chilly day with some clouds starting to trickle into some of our northernmost communities. Partly cloudy skies out there. Temperatures have been warmer today, all due to the winds coming out of the south. Still a little elevated in places like Havre de Grace and Centerville, where it's over 10 miles per hour right now. That's brought some milder air into the area, and temperatures have already started to dip into the upper 40s, which roughly is about 10 degrees warmer than we were yesterday at this hour. So we have to accept the winds where we get them, although needing the jacket if you're stepping outside over the next few hours. Low 40s by the 11 o'clock hour, with overnight lows dipping into the upper 30s for most of us. But I'm tracking some warmer numbers on the horizon. We'll break down the latest coming up in just a few minutes.
All right, Patrick. After a burglary in Federal Hill, customers are coming to the aid of one small business owner. As WMAR2 News' Dave Detling tells us tonight, the cross-street shopkeeper has been able to get